Hi everyone, this is Glenda Ganzon and welcome to my Human Anatomy and Physiology class. And for today's lesson, I'm going to introduce to you the rib cage or the thoracic cage of the human skeletal system. So stay tuned. The thoracic cage, or what we call as the rib cage, forms the thorax, or what we call as the chest, portion of the body. It also consists of the 12 pairs of ribs with their costal cartilages and the sternum. The ribs are anchored posteriorly to the 12 thoracic vertebrae, which are the T1 up to T12. The thoracic cage protects the heart and lungs. The sternum is the elongated bony structure that anchors the anterior thoracic cage. It consists of three parts: the manubrium, the body, and the xiphoid process. The manubrium is the wider superior portion of the sternum. The top of the manubrium has a shallow U-shaped border called the jugular or the suprasternal notch. This can be easily felt at the anterior base of the neck between the medial ends of the clavicles. The clavicular notch is the shallow depression located on either side of the superior lateral margins of the manubrium. This is the site of the sternoclavicular joint between the sternum and clavicle. The first ribs also attach to the manubrium. The elongated central portion of the sternum is the body. The manubrium and the body join together at the sternal angle, so called because the junction between these two components is not flat but forms a slight bend. The second rib attaches to the sternum at the sternal angle. Since the first rib is hidden behind the clavicle, the second rib is the highest rib that can be identified by palpation. Thus, the sternal angle and second rib are important landmarks for the identification and counting of the lower ribs. Ribs 3 to 7 attach to the sternal body. The interior tip of the sternum is the xiphoid process. This small structure is cartilaginous early in life but gradually becomes ossified starting during middle age. Each rib is a curved, flat or flattened bone that contributes to the wall of the thorax. The ribs articulate posteriorly with the T1 to T12 thoracic vertebrae and most attach anteriorly via their costal cartilages to the sternum. There are also 12 pairs of ribs. The ribs are numbered 1 to 12 in accordance with the thoracic vertebrae. The posterior end of a typical rib is called the head of the rib. This region articulates primarily with the costal fasciae located on the body of the same numbered thoracic vertebra and to the lesser degree with the costal fasciae located on the body of the next higher vertebra. Lateral to the head is the narrowed neck of the rib. A small bump on the posterior rib surface is the tubercle of the rib, which articulates with the fasciae located on the transverse process of the same numbered vertebra. The remainder of the rib is the body of the rib, or what we call as the shaft. Just lateral to the tubercle is the angle of the rib, the point at which the rib has its greatest degree of curvature. The angles of the ribs form the most posterior extent of the thoracic cage. In the anatomical position of the angles align with the medial border of the scapula. A shallow costal groove for the passage of blood vessels and nerve is found along the inferior margin of each rib. The bony ribs do not extend anteriorly completely around the sternum. Instead, each rib ends in a costal cartilage. And these cartilages are made of hyaline cartilage and can extend for several inches. and most ribs are then attached either directly or indirectly to the sternum via their costal cartilage. The ribs are classified into 3 groups based on their relationship to the sternum. Ribs 1 to 7 are classified as true ribs, or what we call as the vertebro-sternal ribs. The costal cartilage from each of these ribs attaches directly to the sternum. And the rib 8 up to rib 12, or ribs 8 to 12, are called the false ribs or vertebrochondral ribs. The costal cartilages from these ribs do not attach directly to the sternum. For ribs 8 to 10, the costal cartilages are attached to the cartilage of the next higher rib. Thus, the cartilage of rib 10 attaches to the cartilage of rib 9. And rib 9 then attaches to rib 8. And rib 8 is attached to rib 7. So the last 2 falls, which are the rib 11 to 12, are also called floating ribs or vertebral ribs. And these are short ribs that do not attach to the sternum at all. Instead, their small costal cartilages terminate within the musculature of the lateral abdominal wall. So this ends my lecture about the thoracic cage or rib cage of the human skeletal system. And if you have any question, please write it in the comment section down below and I'll be glad to answer them all. And if you're still not subscribed to my channel, please do consider subscribing. Also, hit the notification bell so that you'll be updated with my new videos. And if you like this video, please give it a thumbs up and share. Once again, I would like to thank you all for watching this video and for listening to my discussion. Until my next video, bye everyone!